Good afternoon. This is a demonstration of the power injector made by MedRad, model Mark V, series Pro Vis. And today I'm going to be showing you the process to fill the injector, arm the injector, set the flow rates and the volume that you're going to be administering, and also how to arm and disarm the unit. In this demonstration, I'm going to show you how to load the power injector with the contrast. And there's two things that you need for the device. You need the syringe, which is in this carton. Take the syringe out of the carton. It's sometimes a little difficult to come out. It's just a plastic cylinder, and it's very important to note the longest tooth on the device goes in at 6 o'clock. You place it into the device, and sometimes it doesn't like to fit, so you pop it, and it fits right into the groove, which is up in the top, which upon closer inspection you would see. At this point, the device comes with a candy cane, and this will be used to administer the contrast into the cylinder to draw the contrast up. After the candy cane is administered to the top, you take the device and spin it around. Now the device is enabled. Press the enable button here on the front side of the injector head, and you'll see the syringe coming all the way up. Once it's all the way up, you're going to take your contrast, and for demonstration purposes, this will be IsoView 300. You place the candy cane into the bottle. Again, hit enable, and now you withdraw the contrast. Now, there is going to be some air in the cylinder. You want to back it up into the bottle and then withdraw the contrast. When it stops, it should be at 200 milliliters. Take that away, and now the device is filled. You're going to be handed off this cannula device to place in this slot, and then by turning this collar, you are locking it into place. And now you are ready for the injection process. Prior to injecting the contrast, it is important to use this warming collar and place it around the cylinder of the contrast that you're going to inject. Once you're ready to inject, lower the device, and the physician is then going to ask you to purge the unit, at which time you place your hand on the back of the knob, turn it rapidly, and as you can see, the contrast is moving through the tube. Once the physician has no visible bubbles in the cannula, he will then say stop. The unit is now completely ready to enable for injection. At this point, we are going to begin the process to arm and select our flow rate and volume. If the physician asks for demonstration purposes, we will say 15 for 20. You're going to hit this button 2 only, at which time the flashing light says set. You will then set your flow rate. Hit 2 again. There is never a need to hit 3, ever. At this point, you're going to set your volume. You hit number 4 once. You now set your volume. and again hit 4 again. You now have a flow rate of 15 for 25 milliliters. It automatically will set your injection duration at 1.7 seconds. Your pressure limit is a constant 600 psi in regards to the requirements of the cannula. The delay area, you never have to touch. We never use it for any procedures. The rise and fall, we never use for any procedures. The level, it is always constant at 1 of 1. Programming is not utilized. In the process of arming the device, you're going to always, and I emphasize always, use multi-injection. You hit multi-injection, it's going to ask you if the air is removed. You answer yes, and you'll hear that buzz from the device telling you that it is ready to load. It also flashes at the back of the unit, which you're not seeing at this time. However, it will be visible when you have the device armed. Also, the arming area, the multi, will be flashing. We are now ready to fully inject the contrast, and by using the plunger, you are going to, under fluoroscopy, under subtracted fluoroscopy, you're going to wait till you see this illuminated syringe on the left screen. When seeing that, you are then going to inject the contrast, at which time that dose has been injected into the patient. At this process of disarming, you are going to press the multi-arming button once, and you will visually see the multi-light has gone out. You are now ready to actually unload the unit. You are now at this process ready to unload the unit. The process of unloading the cylinder syringe from the unit and complete shutdown of the Pro Vis. Tilting the device up, you then unscrew the collar, remove the tip, discard the tip, remove the collar of the warming collar, and then in the back of the unit, you hit the enable button, and this time you back off the cylinder syringe, at which time it stops. It should illuminate 200 milliliters. You swing the device, take your hand and give it a few taps, and remove the cylinder. You've now completely unloaded the unit. I hope this video, as short as it may have been, will assist you in performing the procedure of utilizing the MedRad Pro Vis V. It is a simple and unique device to use. However, it's very efficient in delivering the contrast needed during endovascular and vascular procedures. And if there's ever any questions, I can always be reached either by cell phone or by pager. Hopefully this will come in handy if I'm not available to assist in a case and you are pushed into service to do a vascular procedure. Thank you.